Today we're visiting with Dr. Amber McKnight from Simcoe Optometric Clinic in Simcoe on Colburn Street. And my first question, first of all, hi.
Hi, Dave.
My first question is cataracts, because I hear a lot of people getting my age that seem to have this cataract surgery. What is a cataract? What's the surgery all about? And is there any funding?
Oh, yeah, those are some big questions. But yeah, this is a great topic. Cataracts are something that most of us are going to have to deal with at some point in life. Anyone I see who's developing cataracts, I usually let them know that sometime after age 40, this is something that almost everybody will deal with. Our eye, right inside the eye, right behind our pupil, we have a lens that functions a bit like a lens in a camera. It adjusts to allow you to see between far and close, and just with time, that clear lens gets hazy, gets opaque, the fibers change structure, and eventually your vision will go cloudy. It can take several years to develop. Sometimes it moves faster than that, but your first signs are usually the vision feels blurry, feels like you need new glasses, or having more trouble driving at night or reading fine print. So it's something that just expect, Dave, in the future your friends are having cataracts, but you're going to have cataracts probably at some point as well. So anybody who's experiencing any symptoms like that, always a good idea to call your optometrist and get things checked out. The fix is usually surgery. Sometimes in the early years, you can update your glasses or your contact lenses, and those adjustments can get you by. But if it's impacting your quality of life, then it may be worth having surgery. So that's not something that we do at our practice, but we co-manage cataracts with ophthalmologists. So we refer you for eye surgery just here in Simcoe, or sometimes Brantford, or Hamilton or London even, depending on maybe other factors underlying eye conditions that you're suffering, or other systemic health issues. But something that almost all of us should be prepared to, deal with at some point.
So when you have the surgery, what do they do? Do they clean it? Like what happens there?
So it's actually a surgery to remove the lens that's gone cloudy and replace it with an implant.
Oh,
yeah.
Okay.
So you get a plastic lens that goes back inside the eye, but it is an outpatient surgery. It's about a 20-minute procedure. Usually, you've got good vision right after leaving the hospital. Require a next day appointment follow up, and usually follow up with your optometrist in about a month to see if you need new glasses.
Wow, I didn't realize it's that quick, and I don't want to say easy, but it's that quick, right?
It's a pretty quick procedure. What's not quick is usually the wait time to get in to have your cataracts treated, because it's something that everybody's dealing with. There's a long list of people waiting to have their cataracts treated. So I always recommend, if you're starting to notice vision changes, come in and get it checked out. And if you're having regular eye exams, if you're over 65, an annual eye exam is a good idea. Your optometrist can tell, if a cataract is approaching or if it's early and it's developing, kind of predict when you'll be ready for surgery and get you referred in a timely manner.
Is it the most common problem with the aging population?
With eyes, for sure.
Yeah.
And I believe cataract surgery is still the most common surgery done in North America. So that's a bit of a summary on cataracts. And again, I recommend visiting your optometrist if you're noticing any signs, or you're concerned about cataracts, or there's cataracts in your family. Give your eye doctor a call, and they can check it out for you.
Thanks, Amber, because a lot of information there that I didn't realize. And as I age, I got to learn all this stuff. I got to make sure that I prepare so that you can, recommend surgery at the right time. What else is new? I mean, we touched a little bit on nearsightedness last year in one of our videos, but I want to go a little bit further. You were saying to me there might be some new treatments or something going on. Can you explain that for the folks as well?
Yeah, so kind of an exciting area with optometry and eye care in the last few years. There's been some research that has kind of pinned down what they think is the cause of nearsightedness or myopia. Kids that develop vision issues seeing in the distance. For years and years, all we would do was correct the vision error, but sort of have to sit back and watch as kids grow and their eyes grow. The vision just progressively gets worse over time until it levels out in your usually early or late 20s. But some of the new research suggests that there's ways that we can intervene to actually slow down the progression of nearsightedness by as much as 50 or even 60% in some cases. So not only does that mean that your kids may grow up not needing glasses that are quite as strong or needing glasses as often, but high levels of nearsightedness are linked with increased retinal detachment, increased risk of cataracts, and increased risk of glaucoma. So slowing down nearsightedness, it's really a global health issue, and the new myopia management initiatives make it a lot less likely that you'll end up with a high eyeglass prescription as an adult.
So how do you slow it down? What's the procedure like? It depends on the severity, obviously, like you said?
Yeah, well, there's a few different ways. The nice thing is a lot of the therapies are similar to therapies that are already done. So specialty eyeglass lenses that are designed in a way to help change the signal that your eye is receiving from your external environment and actually helps your body slow down eye growth. Contact lenses that do the same thing. And there are also some eye drops that can be prescribed as well. So it really depends on the age of your child, how quickly their eyes are developing, and some other factors that will determine sort of which treatment modality is best. But a lot of these things are pretty easy for parents and for families. Just instead of getting a regular pair of glasses, you get some myopia control lenses. And these are available at our office, Simcoe Optometric Clinic, and for many other offices as well.
I did not know that. That's pretty cool. How long have you been doing this now? I'm just curious.
So this is actually the 15-year anniversary that I graduated from the University of Waterloo School.
No way.
Yep.
Congratulations. I didn't know that.
Yeah, it's been a long time.
But it's been a great time, because what I want to ask you is, think about what you've seen, the changes and the progression, right, to help folks with eyesight. Like, it must be huge in those 15 years, because things go so quickly now, right?
Definitely. Kind of emerging technology that was just really being talked about when I was in school is now part of our everyday practice. Every year or two, there's new things that come out with eyeglass lenses and contact lenses and eye drops and diagnostic equipment and new research that helps us detect eye disease sooner and treat it more efficiently. So it's a really exciting time in eye care for sure.
This is my last question, because I know you got to get back to work, but it's an important one. And I was looking around, you saw me looking around. Somewhere in here, I bought a pair of glasses, and I didn't come to you, but it was just at a store. Don't get upset with me. But they're because I sit in front of the computer all day, and it's they break it up, so it's not so quite as intense. Should that be a prescription, and do they work?
So are you talking about blue light glasses? Or
Yeah, blue light.
Yes. Yeah, so that's another kind of interesting topic that's kind of emerged in the last few years, that blue light, which we're exposed to blue light from the sun, but we're also exposed to blue light from our devices. Excess blue light can be linked to interruptions in your circadian rhythm, difficulties falling asleep, but also possibly linked to increased risk of eye disease. So there is some really good science behind blocking blue light. The key is getting a product that's got the proper amount of blue light blocking. Really, if the lenses are blocking blue light, they should have a bit of a yellow tint to them. So it can be challenging if you're ordering something online or getting it from like a retail store to know if it's really the right product. We can make custom blue light blocking lenses. We've got several different coatings and lens treatments, and also build that right into your prescription glasses so you can have blue light protection at all times.
All right. So when we're done here, let's book an appointment, because I want to make sure it's the right one. I mean, it's critical when you're working all day, right? You need to have that. And I found it's made a difference just in the headache, right? So you don't get as much of a headache. Yeah. And I dim my lighting, obviously, when I'm not recording, but it's things like that have come along in the last 15, 20 years that make a huge difference.
There's some pretty amazing lenses available. And, if you've been working on a computer without glasses or with store-bought reading glasses, there can be a real wow factor to get a prescription pair made. And if you're spending, hours a day in front of a screen, you're going to really improve the way your eyes feel and the way you feel, and, improve your vision and make a difference in your life to have a good pair of glasses. I feel strongly about that for sure. So come visit me when you're down, Dave.
Right. Here we go. So there it is. Dr. Amber McKnight giving me solid advice to make sure I'm on the right path. So how can people get a hold of you guys? What's your email, your website?
Yeah, you can visit us at simcoeoptometrist.com. You can find us on Facebook. You can visit us on Colburn Street, 100 Colburn Street North in Simcoe, 519-426-3123. And you can email us, soc@simcoeoptometrist.com.
And you're always taking new clients, correct?
Oh, yeah. We're always happy to see new patients.
All right. Thank you for doing this, and we'll chat again pretty soon, I hope.
Sounds great. Have a good day, Dave.
You too.